Prison welfare charities have told ITV News that pledges to reform mental health care for those behind bars are urgent and essential.
The Prison Advice and Care Trust says psychological problems among inmates has reached alarming levels, but just 1 in 7 needing immediate care actually receive it.
It means thousands of prisoners are kept in isolation due to a lack of capacity in secure facilities. With more, Nick Smith.
Prisons are meant to be places of punishment, but also of rehabilitation, to fix deep and problematic issues and prepare inmates to reintegrate back into society if their sentence allows. But the CEO of Sussex Prison Families, supporting those in the justice system and relatives, says well-being on the inside is at a low point with a lack of family contact.
We had a huge issue with self-harming, so 36% of people were self-harming when we looked at the last inspector's report. And even more alarming is the fact that this is happening on average 3 times per person. We cannot support the problem of mental health issues within prisons until we support the person. And for me, this is a wraparound care of prevention, intervention and rehabilitation.
2 out of 3 prisoners have at least one mental health condition, and in 1 in 10 it will be described as severe, meaning they need to be under the care of a mental health support team. 1 in 20 are also being treated for a serious psychotic disorder like schizophrenia. 2 mothers whose sons have experienced the prison system wanted to speak to me anonymously. Both of their children entered with severe mental health issues which worsened inside.
My son was diagnosed with a mental health condition 4 years prior to his offence and was being managed with the community-based teams. I was able to be involved in that. That doesn't happen in prison. His condition deteriorated to such a degree that one of the nurses said to me when I went to visit that he was frightened, he was bewildered, he was disorientated, and he had lost so much weight that she was dismayed to see him in that state.
Given that your son already had a pre-existing mental health condition when he started his prison sentence, what was life for him like while he was kind of in those conditions?
Oh, terrible, awful. He was very, very vulnerable. He sat in a cell looking at a wall, unable to interact, and he just got iller and iller. There is no rehabilitation for mental health patients unless that they can go to medium secure or high secure hospitals.